Precision medicine is a way to describe how we use genetic and genomic information to inform patient care. And really, in many respects, it's just using the information that's uniquely contained within each tumor, and in fact, in all the cells of our body, to be able to better understand how to harness that information to direct the right drug to the right patient at the right time.
You know, precision medicine has made a huge impact on the field of lung cancer. When I started training many years ago, the truth is, patients who had more advanced disease, especially stage 4, there were very few options that we could give them. And now we have many patients who are living for several years because we have a better understanding, as you've mentioned, around the genomics of their tumor. And now we have precise and more targeted therapies that allow us to be more precise in our treatment of patients.
We need to be really attentive to those differences that can help us take better care of patients and populations. Specifically, what we found with respect to women with breast cancer is that by understanding a particular genetic signature, one that relates to inherited susceptibility to cancer, it has more than just implications for how did that cancer arise within someone and how can we prevent it in family members. It also has a huge impact on how we now treat those patients with breast cancer. And specifically, if there were ways in which we could improve access, especially for our African American breast cancer patients, it could make a huge difference in outcomes.
That is the reason why it's so important that we get these opportunities to every patient, right? And that's one of the goals at City of Hope, is that we are able to get to every demographic, every community, because right now that isn't the case, and that has to change. And I'm excited that we are trying to lead the efforts here at this institution.
Right now, because most of the early studies were done in populations that were overrepresented by white populations, we just didn't have enough information to be able to understand and interpret the diversity of our genome within the context of ancestry and history. Now that we're devoting more energy to do that, I think it's really important for us to recognize that we have to bring to bear all that information so that's equally relevant for all of the patients that we serve.
When we think about genetics, we think about genomics, but we also need to be thinking about social determinants. We need to be thinking about environment, and we need to understand that we are taking care of patients, and these patients are whole, and these patients live in a social context, right? And so we've done some work that have shown that social determinants do impact the somatic mutations. They do impact what tumors look like. And so in order to be more precise in medicine through precision medicine, we're going to need to understand the environment and the social context. We're going to need to understand the structural inequities that patients are experiencing. I certainly agree that now is the time to invest in the future, and I think one reason is because there are considerable populations that are still being left behind. If we aren't focusing on investing in better understanding how disparate groups are having disparate outcomes, then we will continue to see these disparities and continue to sort of sit where health inequity prevails. I think City of Hope is the right place for this work to be happening because we have experts and energy around genomics and genetics and biology and precision medicine. And we also have expertise and passion around health equity. I think, when you are able to bring and integrate those two very important sciences and aspects of medicine together, you're able to make a huge difference.
I think City of Hope is really at the frontier of precision medicine precisely because we are working together. We'll help all of us take better care of patients. I love the way that as an organization we've just made the commitment to recognize the complexity of the issues, but the deep necessity to invest the resources that will help us get to better outcomes for cancer patients, so that we can not only take care of the patient sitting in front of us, but so that we can make a concerted effort to diminish the burden of cancer in the community.